Hi everyone. So today I have the honor of introducing to you Dr. Chitranga. She is a DM Neurology from AIMS and she's a previous DAM student. I'm very happy to have her as an educator back on the DAMS platform. And today I have a very special mission with me. My mission is that should you target INISS for DM neurology? I know many of you, all of my previous students who have done your MD medicine, you're all targeting NEET SS. But should you target INISS? What are the benefits and what should be your strategy? And what is the difference? So, Chitranga, first I want to congratulate you on your achievement and that you have taken the plunge as an educator also that now you are having a program for this particular exam preparation on the DAMS platform. So please tell me about yourself and how your career has been and what is your plan for what advice do you want to give to other students?
Sure, sir. First of all, thank you for having me on your platform, and thank you for also giving me the opportunity to be associated with DAMS. And I was a DAMS student both for my post-grad preparation as well as my super specialty preparation. In fact, for super specialty, I was in Delhi for a couple of months. So basically, I belong to the state of Maharashtra. My UG and PG both have been from Maharashtra. Thereafter, I did DM Neurology from AIMS New Delhi. So when I had appeared for AIMS exam, that time we had separate exams. AIMS का अलग था, PJ का अलग था, Sri Chitra का अलग था, NIMHANS का अलग था. And after my session, then the INI-CT came into being. Now, let's talk about why is INI very special. So first of all, INI is conducted twice a year. Okay.
Yes.
So I'll talk about my branch, that is in neurology. We have something like 6 seats and 7 seats. So total of 13 candidates in 1 year. Okay. So even if you count the attrition ki kuch log chhod ke chale jate hain, of course it is a very difficult course. So even with that, we have a strength of something like 36, 37 residents overall over a course of 3 years. Now, through INI, you can get into 5 institutes of national importance. INI stands for Institutes of National Importance. So that is all the AIMS, जहाँ पे भी neurology seats available है. Second being PJ Chandigarh. Third being your NIMHANS Bangalore. Fourth being your Sri Chitra Thiruvananthapuram. And the last one, which one did I miss? AIMS PJ Bangalore.
Jipmer.
Jipmer, yes. Jipmer Pondicherry. Right.
Yeah.
Now, being from AIMS, I'm obviously going to be biased towards AIMS. So in my time, AIMS ka theory alag hota tha, and AIMS also used to have a practical. Now what they have is one is a common merit list and one is a AIMS merit list. So common merit list mein, the ranking is only as per your theory. In the AIMS merit list, your ranking is as per your theory as well as your practical marks.
Okay.
Right? Now we'll talk about the exam as to INI kaise hoti hai. So like I said, it is twice a year. One session is generally in April and the second session is generally in November. Okay. So we'll talk about the theory. Theory may in AIMS, there is a higher penalty. For example, it is +1 and -1/3.
Okay.
Okay, as compared to your NEET, in which it is +1 and -1/4, or +4 marks and -1 mark. So the penalty
Same as what you have in PG, same
yes,
scheme.
yes, same scheme. हाँ. So उस हिसाब से if you make a mistake in INI, the penalty that you end up paying is more.
Yes.
Yes, but as compared to that, ये जो पेपर होता है, जो INI का पेपर होता है, it is more predictable. I'll tell you how. So what happens in NEET SS is the paper setters, we don't know who they are, but ultimately you will go to different state medical colleges or DNB institutes which have their own way of functioning and own way of dealing with things. As opposed to that, when it comes to INI, the paper is set by the people who actually teach you. So we know that they expect us to know how a bleed looks on a CT scan, or the difference between neurocystic and tuberculosis. This is something that they expect from a first year neurology resident, and this is exactly what they will ask you in your theory and your practicals. So that is why it becomes more predictable. And ये जो topics हैं, these are constant. They don't keep changing it. As long as your Bradley and your Harrison editions are not changing, they are not going to change the topics that they will ask. And they stick to the guidelines. If it is given in Bradley, that is exactly how it will be followed. If it is given in Harrison, that is exactly how it will be followed. So the problem that we have with respect to NEET SS, that you don't know where they've asked that question for, you don't have an authentic source, that does not happen. So your Bradley is your your holy book, and you just have to follow whatever is given. Okay.
Plus, I think the good thing is that you have to study the specialty that you're targeting, not every subject. Like in NEET
Not
SS, you will
every.
have all these topics together. So you don't
Huh.
know what weightage one particular specialty will be there in NEET
Yes.
SS. So when you're
Yes.
preparing for NEET SS, you would be like to be more broad, more wide, that you're covering the Harrison's and the basic principles of medicine. While
Yes.
here you want to go into a neurology specific textbook because your exam will be more neurology centric, and what
Yes.
they expect is the level of knowledge that a first year DM resident should have.
DM resident has. Yes. Yes. Exactly.
So very nicely put actually. And I also wanted to know from you how many questions are there in this paper, and if we can divide it into the subtopics.
Yes.
What
Uh,
subtopics are targeted more in INISS?
Huh. So basically, there are the when we had the exam at that time, we could go back and forth, back and forth. There was no fixed slots. But now, even in NEET SS and in INI, we have fixed slots. So right now, I'll just talk about INI. There are 4 parts, 50 questions each, and 45 minutes. So you have to finish those 50 questions in those 45 minutes. You can't go back and forth. So
Okay.
not only is your the question that you're attempting important, you also have to keep an eye on the timer कि ये अभी ही खत्म करना है. So you can't write it down and then think about it and come back. So in that way, you answer your question and you go ahead. You should be so sure about it. And one more thing, when I was preparing, so people in Maharashtra, our state medical colleges are very good. Like we have KU Mumbai, we have Grant, we have BJMC Pune. So everyone, they are very happy if you, and all of these places have neurology seats, so you're very happy if you get in. Nobody really studies for INI. So when I was preparing, I was very lost. Nobody knew what is supposed to be done. Nobody knew how to prepare for the interview. Chalo, theory nikal gayi. Then interview mein, are you supposed to wear an apron? Am I expected to wear a sari? These were small little things that nobody was guiding me about. What sort of demeanor do they expect? Where am I supposed to sit? How am I supposed to sit? These sub questions aate hain. And there was no training for any of this. So after I got into AIMS, I realized that the teachers, they think in a very particular pattern. They just want to listen to certain words in your interview, and they just want to see that you have a enthusiasm and a will to learn. You're allowed to say, "Sir, I'm sorry, I don't know this answer, but I will read about it." They want to see your honesty and how teachable you are. This is the most important thing that they're looking for in the interview. If you've cleared your theory and you've come, that means you are in the cream of the country. So this is something that you need to communicate in your interview. This is what I learned after clearing it. Maybe if
Yeah.
somebody would have helped me prior to that, it wouldn't have been so difficult. But ye
But
sab
now I think now you have taken the plunge to be that person that would help the future
to help
generations.
others. Yes,
So
yes,
out of the 200 questions that we have in this paper, like if we say these are 4 blocks, do they have any particular weightage that like stroke, head injury, or infections? Like you said, tuberculosis, neurocystic cirrhosis, infections, dementia, epilepsy. Like, do you think they have certain topics in mind and which are more fertile for the paper, or
yes.
what is your idea about it?
So first of all, the ASA guidelines for stroke. This is the most important things. Then the ILAE classification for epilepsy, basic CT and MRI. Like out of 200 questions, you can expect at least 25 to 30 will have images, and those images also will be very easy. That is, you look at the image, you look at the options, and you answer. You don't have to go through the entire, question also. So this again is something that I realized after I saw the paper. कि अरे, you look at the options and you look at the image, and that's about it. You don't have to go through the entire thing. Only that way can you answer 50 questions in a 45-minute block. So basically, you have something like less than, you have 50 seconds per question. So that time categorization is also very, very important, and that you will learn only with practice. That is why in our course that we are starting, we have two full portion exams, so that the children can get used to as to how to attempt and how to better divide their time.
So also in this course that you're running on the platform, what is your division of lectures? That I think you're taking 16 sessions.
Yes.
So what is your plan in these sessions, and what are you targeting to complete? And I feel like if I was in anybody's place, if neurology is somebody's passion, then you should target to do it from the best places. And
I
these are the best places which are called as Institute of National Importance, like Chipmer,
Yes,
PGI Chandigarh, AIMS, and NIMHANS. So why not do it from the best? You heard Dr. Chitranga tell you that many people are happy with their state best colleges, but my question is, many times NEET SS will not happen on time.
yes,
INISS would always happen on time and actually happen twice a year. It's a
yes,
good exam to target. If neurology is your passion, why not central institutes? So, Dr. Sab, I would want you to elaborate on the course structure. What is the structure of the 16 sessions that you are taking? And
yes.
you already told us that there will be 2 mock tests also in this course.
Yes. Yeah. So we started this course almost a month back. Actually, we're done with 4 of our lectures. So the first 2 lectures were regarding the anatomy. So the neurovascular arterial part and the neurovascular venous part is what we completed, including the images which are important and which you should know. And I'm sure most of y'all might have seen at least the basic CTs and basic MRIs. It is very basic. They don't expect you to know rocket science. It is very very basic, which will be available at all district level hospitals, all taluka level hospitals, those common CTs and MRIs. Along with that, the basic arterial supply, that is your anterior and posterior circulation, is what I tried to cover. Following this, we had 2 sessions on ischemic and hemorrhagic stroke. The pending lectures that we now have are seizures, epilepsy, demyelination, neuroinfections. Following this, I'll be covering spinal cord, muscle diseases, cranial nerves, peripheral nerves, along with a practical session on apraxia, agnosia, stance and gait, cerebellum, basal ganglia, and then 2 exams. So this is the
Perfect.
tentative schedule which will be followed. And for now, to give the students more time to study, I'm taking it once a week. But from mid-March till mid of April, we'll be taking the lectures twice a week. Along with that, we will have 2 full course exams.
And these
Uh,
lectures, after they're delivered live, are also available on the app for later on review. If you're a
yes,
resident, you're busy, you can see the lecture later on also. And
yes,
so, if I ask you now, if I think like a student right now who's appearing for INISS, the most important things will be what are the things that are initial level neurologist, what are the diseases he's supposed to see. Number 2 would be the guidelines. All the
yes,
important epilepsy guidelines, stroke guidelines, I should be well versed with.
yes.
Basic of imagery and anatomy, I should be pretty good at because image based questions are a part of the exam pattern.
Yeah, yeah.
But what about updates? How important are the updates in an exam like this?
Yes.
Updates like new things that keep coming,
Yeah.
especially in treatment
So,
of dementia and all those things. They're constantly evolving.
yes,
Parkinson's, they're constantly
yes.
evolving.
Yes. So the we'll divide this into the theory aspect and the practical aspect. So in the theory, you have to absolutely have to know the stroke guidelines. Now, fortunately or unfortunately, we just had an update in 2026, which has come after 2018. So after the 2018 update, we just had an additional update in 2019, and after a gap of 6 years, now we have the complete revamp of guidelines. So those are very important. But even in that, you have to understand that the students who are appearing, they are post grad level. They are not DM neurology residents, so they don't have to know everything in detail. And that's why in this course we have just focused on the things that you should be aware of while treating a patient in the ER. So this is something that not a lot of people understand, that in INI they're trying to test you on what you can deal with in the ER. क्योंकि फर्स्ट ईयर रेसिडेंट ही मैक्सिमम ड्यूटीज करेगा, सो दीज थिंग्स यू कांट मिस. सो दैट वे दिस एग्जाम बिकम्स वेरी प्रैक्टिकल ओरिएंटेड ऑल्सो. So in the course, I've kept the practical guidelines, majorly focused on the practical guidelines, which are essential. Second thing, the ILA classification, the ILA definition, which is given in Bradley. There has been an update, but for the exam, they will still follow the 8th edition of the Bradley. So whatever is given in that you have to follow. This is the second thing. Now, you'd ask me about the neuroinfections. So, tuberculosis, HIV, and neurocystic
Hmm.
so, fortunately or unfortunately, NCC is almost very rampant in Delhi as compared to Maharashtra. Like every OPD, we used to have some 4 or 5 patients with a starry sky appearance and NCCs all over. So, they will show you an image of a contrast CT scan and they will ask you what this is. Now, how this gets converted into your practical exam is, they will show you an image and they will ask you, so for example, they will say that, okay, so this patient has walked up to you in the ER with a history of seizures, and now what do you think this is? And then you will obviously say, ma'am, this is NCC, and then they'll ask you, acha, theek hai, so why is this not tuberculosis? So that is how you're supposed to defend your answer when it comes to practicals.
And also, like, how important it is to be like when you give the practical exam, like suppose you score very high in the theory and the practical, how that score combines. Have you seen candidates who have done well in theory but not in practical, or vice versa कि theory अच्छा नहीं हुआ था,
Yes.
practical में ज़्यादा number मिल गए? ऐसा हो सकता है क्या? मतलब we see this talk
Yes.
going on in social media also. कोई बोलता है कि मेरे को बहुत ज़्यादा पीछे कर दिया उन्होंने practical में, ऐसा INI के paper में, that sometimes discourages students from appearing for the paper also.
Yeah, so my DNB, I did my DNB medicine. I am not a MD medicine resident, and the reason for that is the bond in Maharashtra is very heavy. We have 1 year of UG bond, 1 year of PG bond, and 2 year of super specialty. So after my PG entrance, I decided I want to do DNB because I did not want to go through the entire process of 1 year of additional bond. Uh, so when I was told, when I cleared my theory and I started asking people, now how should I prepare for my interview, the feedback that I got from everyone is, they are not going to take you. They will prefer people from AIMS, they will prefer people from MD from any other college, but they will not take you. This is what I was told. So I went with a very open mind कि जो होगा देखा जाएगा, देख लेंगे क्या होता है. And somehow my interview back then was taken by the HOD of AIMS New Delhi, and ma'am asked certain questions which I was able to justify and I was able to defend. And though I was some fourth, fifth in my theory, I topped in the practicals. So don't go with this biased mindset कि नहीं लेंगे, ऐसा नहीं होता है. They're looking for good people, they want good talent, and they also want good children who become their good alumni. We have a very strong alumni group even now, and if there is a patient who somebody wants to refer to Pune, they'll call me and send it to me. So don't think that way कि theory में अच्छा नहीं आया तो practical में नहीं लेंगे. If you are from not a very good state medical college, they will not take you. AIMS Delhi is not that short-sighted and short-minded. Please leave all of that, just focus on studying and you'll get through.
So I think the most important thing that we've learned from Dr. Chitranga is that even if you're a DNB or you're MD from a different college, it is possible to get into AIMS at the DM level. All you need to do is you need to have a guided preparation where you are focusing on the subject. When we are preparing for NEET SS, you want to be at a level of a final year MD medicine student. While when you're preparing for INISS, you have to be at the level of first year DM resident because
DM
they
resident,
will ask the specialty thing. And you have to be well versed in the commonly occurring diseases. You have to be well versed in the common concepts, including the guidelines and any new recent updates that come, and things that would be on the top, which would be the talk of the department anyhow. Like if a new stroke guideline comes, entire neurology department will talk about it. And as
Yes.
a aspirant, you need to be aware of it. You can't say Kenny. And that is why Dr. Chitranga has structured this particular course. She is covering all the basics. It is wonderfully covered. She is not only covering the advanced things, she's also covering the anatomy. And the first two lectures that she has already taken have been on the blood supply and the venous supply, which are usually the things that you miss. And when you see a patient with stroke, you need to know what territory is involved, what is the blood supply, and all those things. She's covered them in good detail. And she's also taking care that she's including the imaging as well as the each part separately. There is a separate section on cerebellum. She talk about nerves in a separate video. So I think it's an elaborate course, and I also feel it is only one of its kind. And there would be many people
So we
selling
have a
you
practical
courses
thing also.
on these, but this is like only one of its kind. So I am here from my own side giving a shout out to all the future neurologists. अगर neurologist बनना है, AIMS से बनना है, NIMHANS से बनना है, तो ये course है. And she's taken a plunge. Do support her by joining this course. She's taken a big plunge. मुझे ऐसा लगता है कि लोग कर नहीं रहे, गाइड नहीं कर. लाइक शी सेड, जब उसने पढ़ना शुरू किया लोगों ने डिस्करेज किया कि यार तू तो बाहर से पढ़ रही, तेरे को नहीं लेंगे. She's done her DM from AIMS. You could be the next one. Please look at this course. This is the only course where a DM neurology from AIMS is teaching you how to become a DM neurology in AIMS. So she's the right person. You're hearing from the horse's mouth. It is elaborate in itself. You're covering everything. And I believe that it will be the game changer when you go for the Viva Voce also, not just the theory part, for the
Yes.
practical part also. So
Yes.
we have taken the plunge, and we want all of you also, if you are a future neurologist, and neurology is a very beautiful branch. And one final take from your side, why did you take neurology? Not there are so many options now after medicine. You can be an oncologist, you can be a rheumatologist, cardiologist. Why neurology?
Yes. So I'll this is a part of the training also. So we also have two. We'll have sessions on the practical training. But yes, two questions which you will definitely be asked in your practical is, first of all, why neurology, and second will be why AIMS Delhi. So I'll tell you my reason for AIMS neurology. For neurology, it is very personal. When I was 15, I was in 10th standard. My father had a stroke, and right then, sitting outside his ICU, I decided I'm going to be a neurologist. It took me almost a decade to reach that pedestal, but with God's grace, I was able to do it from AIMS Delhi. And I think this answer itself is something that helped me clear the interview, because I was asked why neurology. So, yeah,
That's a
my
good
father.
reason, and I'm sure you are somebody who wants to do something better for the society. When we go through something as strong as you have been through, and you were a child at that time, and you still you thought that, okay, now I want that this should not happen to others, and maybe if I can be of help. And because of that nature, you sort out that, okay, if I can help other neurology aspirants also, you want to
Yes.
like spread the word, touch more lives. I think that is the inner desire that you have, and I
Yes.
hope this course becomes a wonderful course for you. And what was the answer to your second part? Why AIMS?
Um, so again, when I was doing my PG medicine, the things that we did not understand, or the advanced treatment for NMOMOG, things like natalizumab, or maybe some multiple sclerosis patients, or even tuberculosis, who's been under treatment for 5 years, is not responding to treatment. We had to refer them to AIMS Delhi. So it was a
Mhm.
referral center even when I was doing my PG medicine, and then
Mhm.
that thought stuck. If we are sending our patients there, if I'm sending them because I'm not able to help them to the best of my capability, why shouldn't I become one of that, or one of those people who
Mhm.
can do everything that is possible for the patient?
And
So
I
that,
think
that thought stayed.
I I would just once again want to remind the listeners that if you are a future neurologist who want to join your DM in one of the central institutes, I have already given you reasons. One of the most important reason is central institutes take the exam on time. So it happens twice a year. NEET SS is unpredictable. Please target this exam. Start studying neurology at a bit more depth than what you would do, and this is the right course for you. All you need to do is download the DAMS app and select medicine resident as the learning objective, and select the INISS neurology course by Dr. Chitranga. She is herself a DM neurology from AIMS, and I think this is the only course of its kind in the country targeting a very niche audience. So if you are one of those, please connect to the course, and Dr. Chitranga will also personally guide you about the interview and other things as well. This is the initiative that we have taken, and we seek out your support. And if you know someone, if you're listening to this video and you know someone who is wanting to be a neurologist, who is doing his MD or DNB medicine, please connect them to this video. It will be a favor to us and them as well. We want
Yes.
to make sure that we touch more lives. That is my agenda as well. And I
Yes.
also believe that central institutes have their own charm, which
Yes.
sometimes in the rut of life, when you become MD, you forget. You like, अभी क्या करना है, मैं तो जो जहाँ मिल रहा है वैसा कर लूंगा. But they have their own charm. You learn things that you don't learn in other places. There will be a mortality meet happening. There will be a clinical radiological meet happening, neuroradiology meet, neurology and neurosurgery meet happening. And the learning that you get is massive passively as well. So on
Yes.
that note, I look forward to looking to seeing all of you in central institutes. Any final words from you, Dr. Chitranga?
Yes. Getting a seat in a central institute is the best gift that you will give yourself. See, irrespective of what you do, whether you will of course do super specialty. I hope so to God, in the branch of your choice. But 10 years down the line, first of all, it gives you that thing here, maine kar diya. It was a difficult step that I was able to do, and I cracked it. That is one thing. Second thing, life after INICT or after AIMS Delhi, I would say, is very different. The sort of life that I'm living right now is something that I had really, really prayed for. And it was possible because I am a ex-resident of AIMS Delhi, and the knowledge that was imparted to me during those 3 years. So do keep this in mind. Do it for yourself, not for anyone else. Don't do it for Sumer sir. Don't do it for me. Don't do it for your parents, your spouse, anyone else. Just do this for yourself. It is the best gift you will give to yourself.
So on that note, I thank you, Dr. Chitrangna, for your time, and I look forward to seeing this course becoming the best course that any aspirant should opt for in future. This course is available on the DAMS app, and the link to this course is in the description of the video. I wish you all the best, and do let us know if you have any more queries about how to prepare for INISS, specifically for neurology. Please leave the questions in the comments, and we'll personally answer. Thank you, everyone.
Thank you, sir.